Assalamualaikum and good day to everyone. My name is Siti Fatima binti Abdul Hamid. I am OUM student Seberang Jaya. For my subject research and methodology, I would like to give a short presentation on my current research. So my subject was about nurses' perception of the impact of electronic health record (EHR) on the nurse-patient relationship and exploration of communication, engagement, and satisfaction. So for the introduction and overview of the topic, I would like to talk about the significance of electronic health record system in modern healthcare, and then focus on nurse-patient relationship on this topic. Background of the study include the transformation in healthcare with adoption of electronic healthcare record for improved efficiency. We will reduce the time that we need to summarize the patient data. Everything will be in the system, and then it will increase the chances of patient to get the treatment. For example, the doctor need to request all the labs, and then it will be delivered by, for example, helper to the doctor. In order the doctor will come to the patients to see the report. But nowadays, from everywhere, the doctor has to log into the system, and then they will receive everything and plan everything for the patient treatment, and then it will reduce the time and increase the efficiency. So the impact on documentation also, it will be accurate because it delivered automatically. It not need the nurse to transfer by written. Or for example, if we write in the paper before, sometimes the handwriting won't be accurate, and then can be misinterpreted. But the key concern here is the potential distraction from a personal interaction. But for example, the nurse use most of the time to use the system, entering patient data, and then the communication between nurse to patient will be lesser, and then this thing will interrupt the care. Let's go to the next. The problem statement is the core issue, which I mentioned before. Electronic healthcare record system may disrupt nurse and patient communication and reduce of personal interaction between nurse to patient, and then need for balanced interrogation of technology care should be educated to the nurses. So the research question, the key question to address was, how do EHR affect nurse-patient communication? EHR provides access to patient data, potentially improving communication. However, time spent on data entry may reduce the direct engagement with patient. How do EHR influence nurse-patient engagement? EHR allows nurses to involve patients in their care by sharing information, but over-reliance on technology may limit the personal interaction. What is the impact of EHR on nurse-patient satisfaction? Patient satisfaction influenced by communication and engagement may increase or decrease depending on the effect EHR on this aspect of care. So again, research objective. The general objective will be explore the impact of EHRS on nurse-patient relationship. Again, specific objective will be assess nurses' perception of electronic healthcare record effect on communication, engagement, and satisfaction. So I have a few hypotheses to propose on this research, which is one, EHRS significantly impact nurse-patient communication, EHRS significantly affect nurse-patient engagement, and EHRS also influence nurse-patient satisfaction. So, significance of the study, important of this research was to enhance understanding of electronic health record system impact on quality of care, provide an in-depth exploration of how EHRS influence the nurse-patient relationship, which is a critical aspect of patient care. It also provides insight for policymaker and educator and administrator looking for things to optimize the use of EHR system by understanding nurses' perception in EHR system. Healthcare system can be better design a training program that emphasizes the importance of maintaining strongness to patient care communication while using EHRS system. This study had been done by Alobaili 2023 and Mawati ETEL 2025. So it also can contribute to growing body of literature on healthcare technology and its impact on nursing practice, particularly primary care. By examining both positive and negative aspects of EHSR, this research will help inform the broader discourse on the role of technology in healthcare delivery, particularly as it pertains to maintaining a balance between efficiency and compassionate patient-centered care. So for the literature review, electronic health record system in Malaysia has been implemented. This is early effort by the government and the policy framework to modernize the healthcare system. The government has actively been working on integrating digital solutions across various levels of healthcare to improve patient care, enhance efficiency, and reduce the risk of error. On top of that, there is a benefit and challenges in EHRS. The benefit of EHRS in Malaysia are clear. These systems are immediate access to patient medical history, labs result, treatment plan, and all in the real time. This leads to a better decision making, reduce the medical error, improve patient safety. EHRS is also have healthcare work more efficient by reducing the administrative workload, giving healthcare provider more time focus on the patient. But on top of that, there is a severe barrier that has been spit out, which is one major challenge is the financial cost of the implementing and maintaining the EHRS system, particularly in the private healthcare facility. The financial burden of purchasing and maintaining the digital system, coupled with the cost of training staff, can be prohibitive, especially for a smaller private practice or in the rural hospital. Another key challenges was the resistance to change among the healthcare professional, because the age between, because some of the oldest doctors are refusing to do so because they said they have a lot of things to learn. Many healthcare workers, particularly nurse and the doctor, are accustomed on traditional paper-based system, as I said, and adapting to a new digital system requires significant time, effort, and training. Okay. Additionally, some healthcare providers express concern about to usability of the electronic healthcare record, citing that the interface can be complex and time-consuming to navigate, which may reduce efficiency and hinder patient care. Future prospect was including blockchain and advanced system. Blockchain technology to enhance the functionality and security of electronic healthcare system in Malaysia suggests that blockchain-based EHRS could be provide an additional layer of security by ensuring patients remain unaltered and accessibility on authorized individual only. So as the technology evolves, there is a potential of artificial intelligence to be integrated to EHRS system. AI-driven decision support tools could significantly improve the quality of patient care by assisting healthcare providers in diagnosing and treating patients more accurately and efficiently. This advancement could further elevate by capability of EHRS system, enhance overall healthcare deliveries. This is by Mudaris in 2021. So methodology, I'll talk about study design setting, overview of the study design method, data collection method, instrument and process for gathering data. So for the study design, the study will utilize quantitative research design to explore nurse perception of the impact of electronic healthcare record in this nurse-patient relationship and is focusing on communication, engagement, and satisfaction. Quantitative research is appropriate for study and is allowed for the collection of numerical data that can be analyzed statistically to uncover pattern and relationship. The research will adopt cross-section survey design, which is commonly used in study aiming to gather data at the one point and in time a specific population. This is adopted by Creswell 2014. This design helped to assess the perception of nurses regarding electronic healthcare record system and their impact on interaction with the patient. So, for the study setting, it can be conducted in public health and private healthcare facilities across the Malaysia, and this diverse setting allow broad representative of nurse experience in EHRS system use. The selection of both public and private hospital ensure that the study capture the various way of EHRS are implemented across the different sector of healthcare system. As noted by Kamarudin ETAL on 2020, the adoption and implemented of electronic healthcare record system may be vary between private and public sector. It provides comprehensive view of the system impact across Malaysian healthcare employees. The primary instrument for the data collected will be structured questionnaire. So the questionnaire will be designed to gather quantitative data on nurses' perception on the EHRS system in terms of their effect on communication and patient engagement satisfaction. So in this research, there is ethical consideration that we have to look on. So validity and reliability, the importance of ethical standard in research is a paramount in study to ensure that the research is conducted with respect participant right and privacy. Prior to the data collection, approval will be obtained to a relevant ethic in review board. So participants will be informed about the purpose of the research study, the voluntary nature of the participant, and the confidentiality of the responses. Informed consent will be obtained from all the participants before they begin the survey. So to ensure validity, which is the accuracy and reliability, the consistency also, the instrument used will be carefully adapted from previous study which proven reliability. This is by Ramyo ETAL 2030. The survey will be tested with a small sample of nurses before the full-scale data collected began. And any necessary adjustment to the questionnaire will be made based on feedback from this pretest to improve the clarity and relevance of the question. So I also will add the pilot study and the data analysis plan. The pilot study will be conducted to assess the practically and effectiveness of the survey. How this happened. The pilot study will be involve a small sample of nurse, approximately 30 participants from a hospital setting. This trial run will help identify any issue with questionnaire such as unclear question or technical problem in the survey online. Feedback from the pilot study participant will be used to refine the questionnaire and improve its design, ensuring that it's accurately measured to intent construct, communication, engagement, and the satisfaction. The result of the pilot study will be not included in the final analysis. The data will be analyzed using descriptive and inferential statistical method. So description statistics such as frequencies, percentage, and means will be used to summarize the demographic characteristic of the sample, the overall response to the survey question. To examine the relationship between the independent variable communication, engagement, and the satisfaction, and the dependent variable nurses' perception of EHRS impact. Correlation analysis will be performed if necessary. More advanced techniques such as regression analysis may be used to explore the impact of each independent variable on the nurse-patient relationship. So, for the conclusion, what I would like to address is the importance of balancing technology with the patient care, which is critical in the age of EHRS system use. While technology has been the potential to improve efficiency and outcome, it should be never overshadow the human element of nursing that is essential and effective for healthcare delivery. By prioritizing the balance of healthcare provider can enhance both patient and nurse experience, ultimately leading to a better healthcare outcome. So, of course, need for further research to optimize EHRS use for further essential to understand the complexities of EHR use in healthcare by focusing the interplay between technology and the human interaction. Further study can be helped to optimize EHR system to enhance rather than inhibit the quality of nurse-patient relationship. This optimization is crucial to achieving a better healthcare outcome and maintaining a patient-centered approach in care delivery. Here I attach a sample of a permission letter and the consent. These are example of the questionnaire. So the total of the question depending on what I include in my research project. Okay, thank you for listening. From me, Siti Fatimah binti Abdul Hamid.